Welcome back to Midnight Med. This video is on nutritional needs. We will first talk about how to identify patients who require nutritional supplementation and then discuss the benefits and disadvantages of each of the options. So first you have to identify patients who have malnutrition risk factors. Now these could be disease-related or it could be due to an increased demand for nutrients. An increased demand for nutrients may happen post-surgery if the patient has a serious infection or trauma. Disease-related include dementia, so the patient may forget to eat, their swallow may not be great, so have a high aspiration risk. Malabsorption, so they're eating but they're not absorbing everything, so they're not taking in their nutrients. Or cancer, which has a higher increased demand as well. The most simple and least invasive option is oral intake, so you're modifying their diet. Usually it's high protein, fortified foods, and supplements. The benefits are that it is physiological, so it's what most people do. It's simple and it prevents gut atrophy. Like most muscles, if you stop using it, it can atrophy, and the gut is no different. Disadvantages, however, include if this patient has a compromised swallow. For example, with dementia, they have a high aspiration risk, and maybe you don't want them to swallow. Also, if the gut function is impaired, you run into risk of malabsorption, for example, with an ileus. Enteral is the next option, and this is feeding directly into the gut or the intestines, usually with a nasogastric tube, but it could also be a nasojejunal tube or a PEG tube, so you're going through the skin or percutaneously, as shown in this diagram. Indications, so we're basically thinking about the disadvantages of the oral option, as enteral is the next step up. So if the patient has an impaired swallow, you bypass the swallowing, or delayed gastric emptying, again you're bypassing the stomach, so you're going directly into the intestines. The patient may have gastric emptying issues if they've had recent gastric surgery or gastroparesis, for example, from diabetes complication. The benefits are that you can have early post-op feeding because you're bypassing to some extent the ileus issues, as well as it helps immune function. Disadvantages are that you're still feeding it into the gut, so if there's an ileus, it's not ideal. It severely reduces the aspiration risk but doesn't completely remove it. And as with most interventions, it is user dependent, so it is possible they may put it in the not perfect position, or they could go through a structure, which is called perforation. The other most invasive option is parenteral. This is intravenously, so via PICC line, a central venous catheter, or a portacath. So we are bypassing the intestines, in that we're not going straight into the intestines like a NG tube. This is indicated if you have an obstruction of the intestines, so small bowel obstruction, you have a diseased bowel or fistulas, so any reason why you want to avoid an area of bowel. The benefits are that it gives you great control over its nutrition. So because you're putting it into the veins, you know almost exactly how much is being made use of, instead of dealing with the inconsistencies of absorption. And in that way, it's independent of gastrofunction, both the bowel function as well as any gastroparesis issues we talked about before. Disadvantages, however, is that TPN, or the nutrition you're feeding through the intravenous access, increases the risks of clots. So you can get DVTs, which can progress to PEs, and if you clot, or for example, the tube kinks, as sometimes catheters do, you lose access and you have to do it all over again. And this diagram shows how you're feeding it into the vein to get perfect access. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.